Namaste everyone. Today I am talking about the malignant otitis externa. It is a severe life-threatening infection of the external auditory canal, which spreads the skull base and surrounding soft tissue in the ear. It is malignant. Term is malignant, but it is not a malignant. Don't confuse with it. It is an aggressive one. Malignant means it can attack so fast and aggressive. Etiology, everybody should know, and if you come in the bio exam, you have to know this is the Pseudomonas aeruginosa. Other factor we have to look in this disease is diabetes mellitus, and most important factor. Next one is immunocompromised patient, maybe HIV, chemotherapy. This kind of disease occur in this kind of setting. Next, pathogenesis. This is the disease infection begin in the external auditory canal. Okay, and in bed where cartilage and bony junction. In external auditory canal, there is a junction between bone and cartilage where infection start and spread to the temporal bone, especially then go the skull bases and cranial nerve. What are the clinical features? My examiner can ask, what is the clinical feature? You have to tell. There is a deep-seated pain, otalgia, which is worse in the night. That is the term you have to mention. There is a foul-smelling greenish discharge, green color due to Pseudomonas. Everybody should know. Hearing loss, yes, but you have to focus more in the deep-seated pain at night. These diseases are refractory to what? Local antibiotic here. You can see, okay? These are worse in the night and it's not helped by the local antibiotic. What is the sign? Most of the cases we can see the granulation tissue at cartilage and bony junction. Okay? This is almost pathognomic. You can feel the tenderness over the mastoid, sometimes the TM joint area. What is the knob involved with it? There is a palsy. You have to mention the seventh knob, which is the most common. There is a possible other knob, but you have to mention the seventh knob. Seventh facial knob, maybe there is a paralysis. Investigation, we can do culture of this Pseudomonas organism. Blood sugar, yes, you have to do the blood sugar because these are the prone to diabetes mellitus. In diabetes mellitus, there is a association with the malignant otitis externa. So blood sugar, if there is high, you have to control the blood sugar with endocrinologist. Imaging, we can do the CT scan and MRI and see bone erosion. Some examiner asks about the radionuclide scan, technetium-99 or gallium-67 to assess the extent and healing. There is a criteria, Levinson criteria. You can see here there is a major criteria and minor criteria. A major criteria should be there. One I already mentioned there, nocturnal pain. Nocturnal pain, there should be purulent otorrhea, which is a greenish color, should be edema around ear. And if you examine, there is a granulation tissue. These are the major criteria. Sometimes micro abscess if you operated. And technetium, also they putting the criteria for bone scan, technetium-99, bone scan for the failure of the treatment more than 1 week. What is the minor criteria? Pseudomonas should be sometime you can see or may not be. Yes, old age, diabetes, you have to look. Seventh knob involvement here and positive radiograph and other debilitating condition we have to look. Treatment, first important is stick diabetic control and give systemic anti-pseudomonal antibiotic. What are they? IV ceftazidime. I prefer the ceftazidime, and next one pipjo, piperacillin and tazobactam. But in exam, first tell oral ciprofloxacin. First oral ciprofloxacin not help, go the piperacillin, tazobactam, then ceftazidime. Topical antibiotic role, there is less chance. So there is a pain, so you have to give antibiotic. What is the surgical procedure in this kind of malignant otitis externa? You have to come with a debridement of necrotic tissue of this malignant otitis externa. You have to remove the abscess if there is abscess and remove the sarcostom. Facial nerve decompression is rarely done here. Other cases, yes, some traumatic case, and other cases, yes, we do the facial nerve decompression, but here not used that much. Complication, there is a facial nerve palsy, skull-based osteomyelitis, meningitis, brain abscess, sometimes it can be death occur. These are the important highlight here. So we cover the most important term in malignant otitis externa. Hope so. Thank you. Bye.